Are you having a hard time getting your child or clients potty trained? I'm Dr. Mary Barbera, and today's episode, we are covering 5 easy steps to get started or restarted with potty training for kids with autism and toddlers with developmental delays. So, we are going to cover what is in this brand new free potty guide available at marybarbera.com/potty, or click the link on or around this video. You'll want to download the guide, and I am going to walk you through it because what's in here can really make the difference, even if you've struggled for months or years. So let's get to it. Okay, we have done a ton of potty training content over the past decade, which when I've been selling courses online. And I've been at the potty training game since the 1980s when I was a nurse on a neuro floor. Then I was working in a rehab setting with head injury patients and spinal cord injury patients, and where bowel and bladder problems were rampant. So when I hit the autism world in the late 1990s, when my firstborn son Lucas was diagnosed with autism, I had all that nursing background in terms of potty training. So I have been called the potty queen. I maintain my RN license. I'm a behavior analyst at the doctoral level. I'm a mom to 2 adult sons, and I have been potty training and writing and speaking about potty training. Both of my books, my newest book, Turn Autism Around, and my old book, The Verbal Behavior Approach, both have potty chapters. I would definitely read the new book versus the old book for all kinds of newer information, but definitely some of the potty training advice in my first book was published in 2007. I would not recommend a few things in there that I do differently. And one of the things is I use a very positive approach. There is no overcorrection, no what we used to call positive practice, which is actually a punishment procedure. So all positive for potty training. And I'm going to go over the 5 steps where you can take a child. We're going to talk about when and how, and, is it too early? Is it too late? Spoiler alert, it's never too early or too late to begin pairing the potty or the toilet and to make this a top priority. So let's go over, before we get to step one, let's go over, and if you don't have your guide, marybarbera.com/potty, let's go over some of the prerequisites. And I use that term pretty loosely because some children with autism are not going to meet these prerequisites. And if you have a child over the age of 5 that meets very few of these prerequisites, we're still able to potty train them, and we still should be focusing on that. But in general, it's easiest to potty train kids who have the following prerequisites. Over the age of 2, I have read some books about potty training babies, and we do use some of those techniques in kids that don't meet the absolute prerequisites here. But if your child is under 2, it's probably too early, especially if they have developmental delays. The second one is they can follow simple directions. Have predictable bowel movements. So they're not just having bowel movements constantly throughout the day or at night. They can stay dry for up to 2 hours at a time, at least an hour and a half. So in the meantime, I really want you to try to keep the child as dry as possible. So don't let them walk around in a soppy wet diaper. They should be feeling they're wet, they're dry. And it's not good for their skin or anything else to let them pee in a diaper and not change it as soon as possible. It would be nice and really helpful if they can pull their pants up and down. This is an 18-month skill. Even with some help, they should be at least trying. But again, if they're not, it's not none of these alone are deal breakers. Um, some other skills we'd like to see before potty training: responds well to reinforcement. Do you know what they like? Do they smile? Do they take the reinforcement? If it's an edible, do they eat it? Do they smile when you blow bubbles? What kind of things can you use as reinforcement? What are their favorite drinks, snacks, toys? Um, and so we want them to be responding to reinforcement. We want them to sit at a table with you and either engage or have their meals. If they're constantly running around and they won't sit to eat a snack, or they won't sit to have you look at a book with them, or won't sit at a small table to engage, they are probably not going to sit on the potty. And so we do really recommend all the techniques that are in one of my 3 online courses. We have a toddler preschooler course. We have a school age course to help kids over 6. And then we have a brand new professional only course and all access membership where we really guide professionals. So if you're having trouble with some of these prerequisites, they won't sit, they won't follow directions, we probably need to go a little farther, which we're going to cover in more detail. And then the last prerequisite is they show some discomfort with wet or soiled diapers. They go behind the sofa to poop. They go up in their room or down the basement. This is all just awareness. They don't have to necessarily communicate, but just like a newborn wouldn't have any problem with just going when they go. It's more reflexive. So a toddler, preschooler, young child, it would be helpful to have them noticing that they're wet. If they come over and, touch their diaper, or, indicate, bring you a diaper to change them, that's really great and shows a huge awareness, which is awesome. And like I said, if you have a child that's over the age of 5, studies have shown that we can potty train pretty much any child. Doesn't depend on their level of intellectual disability. I mean, there are kids that are in wheelchairs that have bladder and bowel issues that I can't say 100%, but if a child is walking and talking and responding to reinforcement, um, even if they're not talking, but just responding to their environment, we can pretty much get them potty trained. Might take a lot of effort, but we can definitely do it. Okay, so let's go over the 5 steps. Step number 1 is you do an assessment. And this is across the board. We need to do an assessment so that we can figure out where the child is at, not just in terms of potty. Everybody wants to like jump into the main problem, but we need to take a step back. So the Barbera Early Childhood Assessment, we call the Becca, BECA, is a free assessment. It wasn't always free. It is now free. You want to take the Becca. You can go to marybarbera.com/assessment to take the Becca. It will give you scores in self-care, picky eating, sleeping, potty training, grooming, and dressing, pulling pants up and down, for instance, washing hands, those kinds of skills, which are going to be really important for potty training. So you get a score in self-care for the child, you get a score in language and learning skills, and you get another score, a 3rd score in problem behaviors. And that assessment, the Becca assessment, can be done in 10 minutes or less. It's really helpful if you have the parent or a parent and professional team do the Becca assessment together. And that will really give you some indication on all these other prerequisites, sitting at a table, following directions, pulling pants up and down, and you'll have your baseline. So once you have your Becca, you're also going to assess potty. Have they ever peed on the toilet? Have they ever pooped? Do they indicate that they're wet? Do they go behind the sofa? You know, those kind of assessments. Have you tried? How many times have you tried? What have you tried to get your child potty trained? Because obviously, if the child's not potty trained, all the trying in the world isn't helping, and we need a step-by-step system. So, step one is definitely do an assessment, and that's all outlined on a whole page here. And it says, remember, potty training is a skill, not a race. And so, for some kids with autism, or developmental delays, or any kind of disorder, it may take weeks or months or years, but it doesn't have to. And especially if a child is walking and talking and responding to reinforcement, it should not take that long. We have a high touch coaching participant right now, and she had a couple false starts with her 3.5-year-old daughter, and she used these techniques that I'm going to go over, and she got some coaching on top of it, and she was able to just potty train her daughter just recently in just 1 week. So there is hope. It doesn't necessarily mean your child is going to go that fast, though. So be patient. Step number one is assessment. Step number two is start early prep. As I said, it's never too early or too late to start or restart pairing and potty training. It might be too early to start actual intensive potty training for a newly turned 2-year-old or a 2.5-year-old or 3-year-old, because you have to think not just of their actual age, but if their language ability is much younger, their ability to follow directions and respond to their environment is severely delayed. Like for my son Lucas, he was 3, but his language ability was more like a 1-year-old. So we have to take that into consideration, and it might be too early to start intensive potty training, but it's not too early to pair the potty, to pair the little table and chairs, to work on pulling up and down their pants over a diaper, to, doing hand washing. And I have a free bonus video on hand washing we can link in the show notes. So we're going to have to, start somewhere, and that somewhere is usually, we're going to talk about what materials you need, but having times of the day when the child does sit on the toilet, at least for 5 minutes or 2 minutes. It might start out with seconds, but we need some sitting. And you might say, well, I have a boy, they can stand. No, 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 no. That's one of my biggest tips is boys need to sit to pee until they are fully trained for pee and poop. I'm going to do a blog soon on one of the problems I see with older kids, older boys who are pee trained, but still ask for a diaper or still are not poop trained because they were allowed to stand to pee. If your boy is already standing to pee and having success, maybe they stand to pee, but then part of the routine, at least during intervals when you think there's a high likelihood of pooping, they will sit too. Because we need to have them sit to learn to relax, to pee, and then to poop. So starting early prep with scheduled sits, extra fluids, and I, as a registered nurse and a behavior analyst, I do not believe that we should do an all or nothing right out of the gate. Oh, we're starting potty training, no pull-ups, just underwear. No, it makes a mess of everything. It makes a mess of your sofa, your rug, the car seat. We want the child to be successful, and we don't need the potty training experience to be punishing to parents. So I have a gradual fading out of pull-ups, and some kids do need, to just put underwear on. And I've had one family that went to the dollar store and she got some shower curtain liners and she just lined them out into the living room so that if the child was in their underwear and peed, it wouldn't hurt the carpet. So you can be resourceful, and some kids need that feeling of peeing just once or twice, and then they get it. So for each child, it definitely is going to need some individualization, but starting early prep is key. Step number 3 is we want to pick the right time. We don't want to start potty training if you're going to be moving next week or you're having a baby in 3 days or even in a week or two. You really want to look at the next week or two or month when you're going to be home a lot, that you're not going to be going on vacation, the child doesn't need surgery, all those things. You're going to want to really pick a time. And a lot of times, summer vacation, holiday time when the child's out of school, and there is a window of time when you're going to be home a lot, might be helpful. So, we also need to decide if potty training is going to start in the home, start at school or in a clinic, and then, or start in both places. That might be a little tricky. And we want to, in one of these steps in here, is pick the right or the terms we're going to use. So if one person says poo, one person says poop, person says poo poo, one person says bowel movement, you can see how that for a child who's language delayed can get really confusing. So if a child is younger than 5, I always say potty. But if the child's over 5, and if you're from a different country, you obviously can pick whatever you think is appropriate. But if you are starting some pretty serious potty training after the age of 5, I would go with toilet or bathroom versus potty, because then that's another switch in language that we have to do. Okay. Step number 4 is gathering materials. I used to recommend the little Fisher-Price frog potty, which was a little potty for little kids. I still don't hate that idea for very small children, like 2 or 3, but boys can pee over the top. And then we have to make that transition from the small potty to the regular bathroom. So now I am much more into picking materials with a toilet ring insert, which is pictured on the front of the guide. Again, you can get the guide at marybarbera.com/potty. So it could be a toilet ring like that. And don't forget step stool, which is part of our materials, because children and adults really need to have their feet not dangling, but secure. The whole squatty potty, for instance, it was a huge breakthrough for adults to have bowel movements easier. And speaking of bowel movements, I did another podcast a couple of years ago with Dr. Steve Hodges, who's a pediatric gastroenterologist. No, he's a pediatric urologist, which is a pee doctor, yet 99% of what he does is treat kids with pee accidents and poop problems. And he is under the impression that in over 95% of the cases, if you have ongoing wetting issues, ongoing nighttime training issues, ongoing poop smears, he has found that 90 to 95% of the time it is related to constipation. And he has a whole system. He's got a couple books. I interviewed him. We will link that in the show notes. He is a wealth of information. So in addition to, and we're still on step 4, the toilet ring, the step stool. Sometimes they have those contraptions that are all in one with the stool, with the toilet insert and the steps all in one. You'll need probably some potty books, visuals, videos that the child likes about potty training. A timer or alarm. I like to use a freestanding timer versus on your phone. Um, and keep that in the bathroom. So if we can say, okay, let's sit for 5 minutes, and you can set either a regular timer or they have those visual timers, which are nice. You're not going to be able to start there. Most kids won't sit for 5 minutes at a time, but you might start with just a few seconds, or let's count to 10 and mommy's going to hold you and we're going to sing a song, or we're going to count to 10, or we're going to count to 100. You'll probably need some data sheets or at least a calendar to know that, hey, we're working on every hour schedule, or we had success with a bowel movement first thing in the morning. Or whatever the situation is, my calendar system, I have a calendar blog, which that is the minimum you're going to do data wise. We have some potty sheets within our course. We have 2 bonus videos within our courses, one for more basic potty training and one for lingering problems that often come up. You'll need reinforcers, not for just potty, but for everything. So we like to kind of get some strong reinforcers that are just for potty training in the middle of potty training, and easy on, easy off clothing. This is not the time for fancy things with snaps and buttons. We need loose clothing that's able to be pulled down, pulled up easily. And that's super important. So that is step 4. And now we are on to step 5, which is it's important to get everybody on the same page, whether that be home, school, both the parents, if you've got a nanny or a babysitter or the grandmother living with you or watching your child. We need to all be using the same terms, all be using the same schedule, all be using the same reinforcement, the same data collection, because otherwise, this skill is not going to be easily taught. But it can be done. I have seen and helped with potty training on probably thousands of kids over the years in some capacity. Um, and just to know that it is possible. And if you are struggling with potty and you're also struggling with any language problems, your child's not conversational, child's not speaking in one word utterances, speaking in little scripts, and you have some problem behaviors, refusal to go on the potty, um, flopping, aggressions, self-injurious behavior, whining, crying, hitting kids at preschool, we I really urge you to not just look at potty, but look at the whole picture and the whole child, and make some systematic changes so that your child is successful and that you, as the parent or professional, can see this success. Once you see success, you'll be even more motivated to keep putting more procedures in place to help each child reach his or her fullest potential. So download the potty guide, marybarbera.com/potty. Attend a free workshop. I even have one BACB CEU or one contact hour for behavioral and early intervention professionals attached to the pro webinar now. I also have 2 different webinars, one for parents of toddlers, one for parents of school age kids that are older. So you can attend for that for free. I would really urge you to join our online course and community where you can ask questions. You can attend getting unstuck calls. You can talk about potty as much or as little as you want there, but we are going to look at the whole child, and we're going to help you look at the whole child to get them to the next level. So check out all the show notes for all the other potty advice, but don't swim around in free information. Dive in, read this 7 pages. Read this 7-page potty guide and get to it. And if you have trouble, dive in deeper, join our online coursing community where we can help you get your child or clients potty trained quickly with less stress. So hope you loved that episode. Check out all the details below, and I'll see you right here next time.